Do you have hip and knee pain? Try these 5 simple exercises for almost instant relief. If you've been struggling with hip pain and knee pain, you're not alone. For over 30 years, I've helped thousands of people just like you eliminate pain and stiffness in their hips and their knees almost immediately. In this video, I'm going to show you 5 simple but really powerful exercises you can do right at home to relieve your hip and knee pain. Here's the best part. You don't need to go to the gym for this one. They're easy. You'll feel the difference almost immediately, and I'll show you an advanced version and an easy version. Stick with me. You'll be moving better, faster in no time. Hi, I'm Dr. Gregory Kramer. I have over 33 years of clinical experience and certification in chiropractic biophysics, or CBP for short. I've had the privilege of helping thousands of people just like you. I specialize in treating chronic problems like chronic knee pain, chronic back pain, chronic hip pain, peripheral neuropathy, disc bulges, disc herniations, and other degenerative spinal conditions, and I use a variety of corrective methods, spinal decompression, and targeted exercise. Now, before I continue this video, I need you to hit that subscribe button if you want to learn how to relieve pain, avoid surgery, stabilize your spine so you can live stronger longer. I upload a new video every week. Hip and knee pain typically go hand in hand. Most of us walk on our feet, so if there is a weakness or immobility in your hip, usually gets transferred down or upstream. So for instance, if your hip is weak and stiff, sometimes that leads to knee pain, sometimes it transfers problems upstream to your lower back. Either way, if you fix your hip, you're going to stabilize your body. You're going to eliminate many knee problems and lower back problems. And that's going to allow you to walk better, stand better, climb stairs, play with your kids. You want to be able to walk long distances and to sports games for your kids and grandkids. So stick with me in these videos because these videos are simple, and I've got some advanced versions, and they're fun, and you can do them at home. So these are simple exercises you can do to eliminate pain, stabilize your body, get stronger so that you can live stronger longer. Make sure you do the test where we test to see what do you need. Do you need more internal rotation of your hip or more external rotation? All the exercises I recommend about between 5 to 10 repetitions. And I would recommend the first week do 1 cycle of 5, and eventually you can do 2 to 3 cycles of 5. And I recommend that you do something twice a day, just like you brush your teeth twice a day. I want you to do some hip and spinal hygiene twice a day because, again, when your hips work better, your knees work better, and your spine works better. So I'm going to show you the 5 key exercises to eliminate pain for good. Let's first start with a test, all right? So we can be a little bit specific here. So our first test is if you squat and you notice your toes start to go out when you squat, that's probably telling you because you're losing internal rotation. And over time, that's going to cause not only back pain, but it's going to lead to hip and knee pain. The other test you can do at home is called a Faber test. Basically, you just lie on your back, put 1 foot over a knee, and notice how this knee goes pretty close to the ground. But let's say this leg only goes this far. You can see it doesn't go down. That means you have an external rotation deficit. So just kind of keep that in the back of your mind that we can kind of personalize and be a little bit more specific in what our body needs to function better to eliminate knee pain. Remember, if you have strong, flexible hips, you're going to spare your low back, your lumbar spine, and you're going to spare your knees. So take care of your hips. They spare your spine and your knees. So our first exercise, and I'm going to go back and forth between an easy exercise and something that's a little bit more challenging. And then you can kind of moderate. We're going to do all 5 of these exercises 5 reps. All right? Now, you decide whether you want to do 1 cycle, 2 cycles, or 3 cycles. And you can listen. You guys can do it right along with the video. So our first simple exercise would be the hula hoop. So this is a beginning person, stiff hips, and basically we remember the hula hoop. You're going to shift to the side, tight stomach, shift forward, shift the other side, shift back, and we're going to go in a circle. The key is keep your stomach tight. Almost every exercise, shoulders down and back, tight stomach, tight butt. If you can remember that, shoulders down and back, Tighten your stomach, tighten your butt. We want to focus on the hips, not the spine. So we go side, front, side, back. So that's 2 reps. So we got front, side, back, side. And we want to go far as we can, far as we can, far as we can, far as we can. And we're going to do 5 repetitions in one direction, and then we're going to do 5 repetitions in the other. So 5, forward, side, back, side. And if you notice, one hip hangs more than the other, we probably got to work it a little bit. Now, if you want something a little more challenging, we'll do 5 reps both legs. So you're going to go left the leg swing, up and back, up and back, up and back, up and back. All right? A little more challenging, you'll do that both sides. Now let's go. Part of that is out and back, out, out. And I probably recommend do some in front and some behind you. All right. So we're going to do 5 reps each side, and that is a good warm-up. Okay, now we're going to work on the key exercise for the hips. We're going to do a chair squat for the beginning. You decide how high. Some of you may need to put several pads on a chair. Go back to my earlier videos. I'll show you. You can load the chair up so you barely move. So maybe you only go this far. Some of you might be do another one. And we're going to basically start at 5 reps and up. Just like that. And we want a really tight stomach. And as we stand, I want to emphasize tight stomach, but really squeeze the glutes so we get maximal hip extension. The key part is maximal hip extension and squeeze the glutes. You want to create that full range of motion. Okay? Now, let's say you have good strength. So now we're going to do full range. All the way down, all the way up, squeeze the glutes. You should feel nothing in your back. We're going to do 5. Tight stomach, squeeze this very last little ½ inch. Super important for range of motion. Don't just stop halfway. Remember, your hip is used to already being in a flex position. You're used to spending a lot of time sitting, so all these structures are shortened. So don't cheat yourself. This last little bit of hip extension, that'll take pressure off your knee and take pressure off your back. All right, so our first one is we're going to do something called a Cossak Squat. So again, this is a little more advanced, and you decide how far you go. All right, so pretty wide stance. All right, and so this is a little harder version, and we're going to do 5 reps. We're going to go side to side. And if you want to hold a little weight close to your chest, that's fine. And here's the key. Try to remain upright as possible. Tighten your stomach. You're going to really feel the inner hip, particularly if you have trouble with internal rotation. So if your feet are always, toes are always going out when you walk or when you squat, really try to work this with a tight stomach and go all the way down, emphasizing being upright, keeping your upper body upright, okay? Try not to let your toes flare too much. A little bit's okay, and you will feel this, but you got to be pretty warmed up before you do this. So we're going to do 5 reps, side to side. And you might want to do a couple of these reps where your toe, I want you to pay attention. Can you see my toe here? Make sure you can see the toe go up. And you're going to get a little bit of a hamstring stretch when you do this, when the toe, and you got to put your hands forward to kind of prevent yourself from falling. So this is great for the groin, the hips. Okay, try to be upright as much as you can. Now, an easier version is we hold on to something. Wide stance, and we just go partial range. Tight stomach. Try not to let your butt stick out too much. And we can hold on to something. And you can go 5 repetitions. Very partial range of motion. Tight stomach. You really will feel this in your inner hip. So, if you need internal rotation, this is a great exercise. And you know you need internal rotation if your toes are always going out. Side to side. And this is an easier version. We're not going down as low. And this is called the Cossak Squat. Now we're going to do 5 reps of the lunge. Obviously at home you do both sides. So, and I'm going to give you kind of not just hard and easy, but I'll throw an extra, an intermediate one. So this is, you take your feet about 2 feet wide, 2 feet back. In our first lunge, we have a vertical shin. All right, and we're tight stomach, and we're going to come up and down. We're going to do 5 reps. Now, once you're warmed up, you've already done the 2-legged squat, you've done the vertical shin squat. We'll stay the same leg forward because that knee is warmed up. And now, this is advanced. You've got to work up to it. Do not try this right away. This will irritate, possibly hurt your knee. For some of you, you're ready to start doing it. But for most of you, this will be 2 to 3 months of progressive, pain-free progressions. Pain-free means you have no pain, no weird feeling while you do the exercise or 24 to 48 hours later. So this is what it looks like from the front. Now we're going to try to keep this back trailing leg pretty straight. Now this knee is going to go farther. Okay, we're not just dropping down, we're going forward, and this really stretches hip flexors. And so my calf is touching my hamstring here. The knee is definitely going over my toe. You have to earn that. You're really stretching the hip in a different manner. So I showed you a moderate. I showed you a hard way. Now let's show you an easy way. The easy way is we elevate the front leg. This is a stretch cage, common at most gyms. If you don't have access to this, use your stairs. So you have something to hold on to for safety. Tight stomach, again, squeeze the glute and go forward as far as comfortable. We're going to do 5 reps. I recommend close for support, but not necessarily using it, so you work on your balance. So we use this often in my clinic. Remember, fixing your hip helps knee pain tremendously and back pain. All right, so we're first going to show an advanced version of something I like to call a windshield wiper. Then I'll show an easy version, okay? So we first get on the floor, and one of the things that you can do, actually, your legs are in a 90 degrees. So in this direction, this hip is internally rotated. This is externally. And we're going to use our core muscles, and we're going to sit up, and here's the key. Squeeze your glutes. So mobility is part strength. So anytime we can combine strength and mobility is always a better stretch than just passive. We go down. We're working external rotation, internal. So we're working both. Squeeze your glutes tight. Really contract. Feel the glute. Should be no back pain. And you're going to feel it on the inside. And we're going to do 5 reps. Squeeze, thrust your hip forward. If you keep your stomach tight, you will feel nothing in your lower back. Big stretch here for the internal rotation. Very good. 5 reps. Now, our hands are here, and guess what we're doing? We're using our core. Now we're going to do 1, 2, 3, emphasizing squeezing and contracting the glute. And number 5, really squeeze. And you could play with how far this knee is open. A little, a lot, whatever feels the best. And really squeezing this glute, particularly the left glute, emphasizing internal rotation. Now, many of you, that's too challenging. So what can we do? We just sit and let the windshield wiper go like this. And maybe we could throw in a twist. This is called a 90-90 with a twist. Very common exercise. 5 reps. And if that's too much for some people, guess what? We just lean back. We lean back more. We lean back and we do a smaller range. What if we just need to do this? 5 reps. Eventually, we don't use our hands. We want to engage our core. Eventually, we get up. So those are the 5 key exercises to stabilize your hip, eliminate knee pain, and help as a bonus with most back pain. Start easy. Nothing should hurt you. So I hope you like these videos. Stop letting hip and knee pain control your life. Again, unless you walk on your hands, you're going to need strong, flexible, stable hips and knees. And these exercises will help you achieve that. And I've given you a lot of tools for a complete non-surgical recovery. Now remember, when you seek professional advice, and ensure that whoever you see not only addresses the point of pain, of course they need to do that, but they need to look at the whole mechanical chain. They need to look at the alignment of your spine, because when your spine's out of alignment, you affect the weight load. We need to look at your hip strength and hip mobility. We need to look at knee strength and knee mobility. And you need to have some type of home care program. If you do all of that, you ensure a greater success for long-term functional restoration and long-term pain relief. Now, if you find these steps helpful for treating hip and knee pain, don't forget, I want you to like and subscribe for more tips and tricks to help you live stronger longer. That's my tagline. Who cares how long you live if you're kind of weak and decrepit? We want you to live stronger longer so you can enjoy all the things you want to do with your friends and family. Also, do me a favor, share the video with friends and family. And most importantly, let me know at the end of the video, what'd you like? What of the exercises did you like better than the other? I always want to hear back from you. Now, the next video you should watch for the hip and knee series is right up here.